Hi, I'm Dr. Kim Langdon, retired board certified OBGYN with LifeSprout Bioceuticals here to talk about menopause. Well, women, it's not a disease. It just happens to be a normal process of the aging process. It tends to happen at the average age of 51 and is gradual in onset. Some of the symptoms start in your 40s and consist of things like hot flashes and irregular bleeding. If it happens before the age of 40, it's considered premature menopause and should be evaluated separately. You can do a blood test for it, but most of the time it's just a process that you wait a year, and if you haven't had a period, then basically you're in menopause. Some women reach out to their doctor because they're having unusual bleeding or hot flashes. Some women get earlier menopause because of smoking, but it's largely dependent on genetics or totally unknown. In any case, besides irregular bleeding, some things to watch out for anytime you bleed beyond 7 days or bleed more frequently than every 21 days or bleed every day. Those are things you should talk to your doctor about because they can be managed with medications fairly easily. One problem that is not well known is that women who are over their ideal body weight make more estrogen than other women. So they might tend to go into menopause later because they don't have the symptoms, or at least they feel like it's later. So what happens is in fat cells, there is an enzyme that makes more estrogen, and that estrogen can stimulate the uterine lining to get thicker. As it gets thicker, it can become abnormal. So anybody who is over their ideal body weight, who experiences excessive bleeding or even an absence of bleeding for 6 months, should consult a doctor to make sure that the lining hasn't built up and that you're not at risk for precancerous or cancerous problems of the uterus. So what are some of the other problems associated with menopause? Well, hot flashes, night sweats, sleeping problems, concentration problems, brain fog, fatigue, vaginal dryness, pretty much anything that happens as we age can be attributed to menopause. But those are the main ones. There's things we can do about it, though. There's lifestyle changes, such as exercising more, decreasing alcohol intake. You can check out supplements. There are some natural supplements that act to help your estrogen levels and to help with some of the symptoms. At LifeSprout Bioceuticals, we have a Facebook page where you can learn more about the supplements, and then you can also learn more about menopause. So visit us there. Have a good day.